So would you be surprised to hear that 1/3 of all cosmetic procedures are performed on men? And that number continues to grow. Did you know that stem cell therapy is becoming mainstream? It's now being used in cosmetic surgery procedures. Were you aware that there's now a permanent hair solution for thinning eyebrows and thinning hair for women? Leslie, thank you for that generous introduction. So I'm really excited to be here because many of you know that this is all in my wheelhouse. I've been working on skin health as it relates to really the gut, fixing our gut, and working through diet and lifestyle changes. But today we're going to add to our anti-aging arsenal with this incredible panel of experts. We're going to be learning about the latest in regenerative medicine and beauty care. So I'd like to start off with our curator of the event. She has brought us these two illustrious panelists. Lynda Barens, she is considered to be the plastic surgeon whisperer. All of us in YPO, WPO, we always have our hands on the latest, the greatest, the best doctors. We have friends who do things. So why am I going to come and spend money on your services? Why am I just going to go ask my friends saying, well, who's doing this for you? Who's doing that for you? Tell me all your secrets.
You know what, Lauren? Everybody does that. They're listening to hair people, makeup people, their friends are looking at work, but nobody has the 25 years of experience that I have.
Who's the bad? Who's the good?
Wouldn't you like to know?
We want the dish, right?
Let's reapply it first.
Okay, so what I found was very interesting was the eyebrow replacement. I have a lot of clients in my practice with Hashimoto's, and with any thyroid disease, you tend to lose the outer third of your eyebrow. It happened to me. So what can be done with that? I see a lot of people doing the tattooing, but you're doing actual hair restoration to that area. Can you explain that process?
Well, what we're doing is taking follicles from usually this area around the back and the sides of the head where the hair is very stable and healthy and strong. And then in our practice, we match the caliber and the color and the texture. And then we implant that, and it's done using a very special sort of proprietary technique the way we do it, that the follicle is introduced at the same angle and direction that the eyebrow would be. Now, eyebrows are challenging because the hair exits at almost a flat angle, so it's very tangential. It's not like a scalp hair coming out at 45 degrees, it's almost flat. And so we originally developed this technology for using with pediatric patients, but it's worked out great with adults because it allows us to get very flat. So when we place the graft, the hair is coming out almost flat to the skin. And that's the hard part because you'll see eyebrow replacement and frequently it's just sticks straight out like that.
So Dr. Ghaly, so what can we do? I know you're a specialist in hormone replacement therapy. Hormone replacement therapy has gotten a bad rap because people don't understand about the difference between synthetics versus bioidenticals. Can some of this hormone therapy be used to treat some of these common problems that we women are facing, whether it be thinning hair, whether it be low sex drive, whether it be any kinds of, even like with your platelet-rich plasma therapy, to regenerate the skin? So we don't have to turn to Lynda and go, Lynda, please set up a doctor appointment. We need to get under that knife ASAP.
The interesting enough is that thyroid is an important hormone in our body, and it is actually a primary gland, not a secondary gland in the endocrine system. So thyroid will affect each one of us, all the cells in our body, whether it's the liver, the skin, the hair, the brain, has receptors, even ovaries have thyroid receptors, and lack of which have detrimental effect. One of them is hair loss, brittlity of the skin, of the hair, so you find the hair standing on end, like on somebody. Or you touch the skin and you know that they actually have a rough skin. And because of that, it is low thyroid. It's just a given.
That's so interesting. A rough skin could be indicative of having a thyroid disorder.
Very
That's
true.
very interesting.
Yeah, very true. So the hair on a woman's head is the crown of her head. For a man, if he loses his head of hair,
Or is that?
He is sexy.